First and foremost, thank you very much for participating in the first Neuromuscular Fellowship Fair. We're excited we've had this opportunity to do this. Between this and the portal, we're hoping that you all have a great experience and some wonderful candidates and just really enjoying the whole process. So today's session will be recorded, and then we will be putting that out on the website so that people that were not able to join us tonight still will have an opportunity to listen to your presentation. So we want to make sure that we give people an opportunity because not everybody is always available every night. So I don't think I have to do too much for housekeeping. It looks like everybody's got their name up on there, so that's great. We'll do the mute on ourselves until we're talking so that we don't have to worry about some background noise. And I think that's about it. Normally we'd have a few presentations, but since Dr. Schroff was not able to make it, Dr. Dominski, you are it.
I am it. Thank you.
You are it. So you may take the floor.
I'm taking the floor. Let me introduce myself first. My name is Mazen Dimashki. I'm a neurologist by training. I did my training at the University of Texas, Houston Medical School back in 1990 to 1993, just a few years ago, barely, like about 5-10 years ago, maybe 30 years ago now. I was counting. After which I did a fellowship at UT Houston back then with Francine Riesendorf and Sarah Austin and others, and then focused my interest in neuromuscular disease since then, first being on faculty at UT Houston until 2007, after which I joined the University of Kansas Medical Center. I'm currently professor of neurology. I've been directing fellowship programs since 2000, so 20 years experience in doing that. And I've learned a lot along the way. I'm delighted to be here with you tonight. And joining us is Eric Ensrud. Eric, I've known him for many, many years. He is multi-talented, skilled. He's going to tell you more about him here very shortly. But the reason why Dr. Ensrud is with us today is, as of March 15th, he's joining us as a faculty member within the neuromuscular division as part of the neurology department. So Eric, do you want to say a couple of words about yourself?
Yeah, thanks, Mazen. Well, I can speak as someone from outside of Kansas City who's very excited to be going to Kansas City. It's a really great neuromuscular group. I did a combined neurology and PM&R residency. So I was a resident for 5 years plus internship in Boston. And then I was a fellow in neuromuscular disease with Anthony Amato. And I spent quite a bit of time in Boston. I was there about 16 years and worked as a faculty there with residents both in neurology and PM&R. I was the main neuromuscular and EMG educational person for 2 neurology residencies, the Partners and Boston University, and then also 2 PM&R residencies, the Spalding and Tufts. And I also worked with 6 neuromuscular fellows a year at Brigham and Women's, had them in clinic with me and worked with me. So I really enjoy working with fellows. And I'm at the Oregon Health and Sciences University now. I'm a professor in orthopedics and rehabilitation and in neurology. And like Mazen said, I'm moving this spring to join their group, who I'm very familiar with. I can tell you they're a super personable group. Amatha Pasnor and Omar Jadat and many other people. It's a really great department, so I am very excited to be moving there and joining them. And I love education and I love working with fellows. So I really look forward to the opportunity to working, with the neuromuscular fellows at University of Kansas.
Thanks, Eric. Well, welcome everybody. This is a delightful pleasure to tell you about the great things about our program here. I started this program back in 2008. I submitted the application for the ACGME to start a neuromuscular medicine fellowship. A year after I joined the KU, we started having our first fellow, and we've been very successful. We have an exciting and unique fellowship program. I'll share with you some of the uniqueness of this fellowship program. But the key thing is when you come here and join us as a fellow, our goal, our interest is not necessarily to see how much work you can do for us, but the main interest, the main focus is what do you need to grow as a clinician that later on when you join in your group, whether private practice or academic, that you'll be able to excel and achieve those goals that you set yourself during the clinic and during EMG and during biopsies and intraocular monitoring all throughout the fellowship. So we have multifaceted fellowship that includes clinical care. It includes also access and availability of research, as well as some requirement for research. But some of the things we do when it comes to pathology are quite unique in the sense that our fellows do their skin biopsies, their muscle biopsies, their nerve biopsies. We have our own histotechnologist that processes the tissue. We are the people that read the biopsy, not pathology. We read those biopsies. And by the way, I'm certified by the UCNS in clinical neuromuscular pathology. And actually, I sit on the examination committee of that, but that's a side issue or side point. So that by the diversity that we offer in the way of a balanced inpatient, outpatient exposure that's diversified, and I'll share more about that with you, in addition to having a research exposure and pathology exposure that really distinguishes and separates our fellowship program from other programs in the region and nationally. So with that, I would like to share my screen and walk through some slides about the KUMC, the Kansas University Medical Center Neuromuscular Fellowship Program that I'm presenting. And this is my name, Mazen Dimashki, today's date. Are you able to see the screen that I'm sharing?
Yes.
Wonderful. Okay. So as a background, we at the University of Kansas Hospital System have been listed for the last decade plus as part of the US News and World Report. And this is our more recent ranking for different disciplines, with neurology and neurosurgery being ranked number 30 nationally. Now, we've had different rankings along the year, anywhere from, I think, the lowest rank, which is the best rank, was 12, all the way up to 30 more recently, which tells you something about just the general environment where you'll be operating, where there's quality care as part of this ranking, as part of the US News and World Report. Now, however, I think that this goes beyond just the general environment to the uniqueness of the fellowship program that we have here at the University of Kansas Medical Center. And in that original introductory statement, I was trying to highlight it to you as to what separates our programs from others. And whether you're interested in private practice or academia, this fellowship program is a sure way to prepare you for both career tracks. This is a picture that you see on the right of a building that says University of Kansas Health System. And this is a building that was erected 3 years ago. And in it is the neuroscience unit, the neuro ICU floor, the neurology floor. All of these are located in this building. And the University of Kansas Hospital is a tertiary referral center, a level 1 trauma center with 50 hospital beds. That's what it says on paper. Now with COVID-19, all of us know every hospital facility has been stretching the number of beds they have. Right now, we have about 850 beds occupied in our hospital system. In addition to that, where we see our patients in the outpatient clinic is a building that's about 10-minute walk from the hospital location. It's called the Landon Center on Aging. In that, we have clinic rooms, we have our EMG operations for outpatient EMGs. This is where we do our muscle biopsies, our nerve biopsies, skin biopsies, where our histotech is located, and where we do research. So, for example, if you're a basic scientist, your research lab is somewhere in a building that's enclosed, whereas if you're a clinical researcher, your research lab is actually the clinic. So that's why our integrated research, for example, when it comes to ALS, we have ALS Association Clinic. So our research coordinator is embedded in the ALS Association Clinic so that patients with ALS are afforded the opportunity to participate in research. That's an example, but all our clinics have in them embedded a research coordinator to help facilitate patient access to neuromuscular research studies. How many neuromuscular research studies do we have ongoing in the way of clinical trials right now? We have 90. I'm not talking about neurology research studies. I'm not talking about multiple sclerosis, not Parkinson's. I'm talking neuromuscular, ALS, neuropathies, myasthenia gravis, Lambert-Eaton, congenital myasthenic syndrome, muscle disease, acquired and genetic. We are across the spectrum of those. We have 90 research studies. Now I'll show you some pictures of how our research staff that supports our research enterprise. In addition, what enriches our fellowship are exposures to our veteran population. Our fellows rotate at the Kansas City Veterans Administration EMG laboratory, and while the EMG exposure at the Landon Center is for more complex neuromuscular cases, the Kansas City VA offers the opportunity to see more of the bread and butter, radiculopathies, carpal tunnels, and things that you'll see more commonly in practice, whether academic or private. So that this is a strength of our program. And another strength of our program is the Clinical Research Center. And this is where we conduct our clinical research studies. You can see a picture of it here on the right. And in this building on the third floor is where we screen research participants for research studies. We see patients in follow-up, in addition to the Landon Center on Aging location. And this location is about 10-minute drive from the Landon Center on Aging. We have our research offices that are located across the street from that. Our research team is housed. This is a very serious picture of typically on graduation day or around that time, the faculty gathers together and we take a picture. One of the pictures has to be a silly hat picture. You see us all here, me in the front there, along with Dr. Dubinsky. Dr. Dubinsky is a vice chair for outpatient affairs. Dr. Lynch is an MS specialist. Dr. Gronseth in the back is the chairman of the department, and others here, our nurses, our graduating fellow here, and residents that are graduating, and other faculty members from different disciplines lining up here. So we have a very collegial relationship, not only amongst faculty, but with trainees, whether residents, medical students, and fellows. And we have this environment of facilitating academic pursuit and inquiry so that you develop into the best neuromuscular specialist that you can be. This person here is Matt Varon. Matt is one of our graduates. Matt has joined us. He graduated from Neuromuscular Medicine Fellowship. He just joined us to be a faculty member within the KUMC. The rotations of the fellowship are several-fold. There's neuromuscular evaluation rotation, in which it's a 3-month longitudinal rotation with inpatient and outpatient exposures. Electromyography laboratory, the EMG lab, is 3 months. Also, it is inpatient and outpatient EMG performance with single fiber EMG learning, as well as intraoperative monitoring and autonomic nervous system exposure. There's muscle, nerve, and skin pathology evaluation, which is a 2-month longitudinal rotation. So every Wednesday, we do muscle biopsies, skin biopsies, and if needed, nerve biopsies. As you know, nerve biopsies are less and less needed, but there sometimes is a need for them. So like this Wednesday, yesterday, we had a biopsy at 8. Dr. Jawda did it. I had another biopsy at 10. I did it. Dr. Pajnor did in the afternoon her skin biopsies. The fellows were there. When I say I did the biopsy yesterday morning, this is how I did it. It's mid-year. The fellows are ready. The fellow went in, consented the patient. I reviewed the procedure with the patient. We agreed on where we're going to have the incision. The fellow scrubbed. The other fellow assisted him. I was inside and outside the room at different critical portions of the biopsy. And they did a great job because they were well trained the first 6 months. And that's what we expect people to be able to show their competency in the second half of the year. Rehabilitation medicine is very important. Eric's strength in joining us is going to be very apparent. And right now, the way we offer that exposure is to the multidisciplinary ALS clinic. In that ALS association clinic, there's PT, OT, speech therapy, nutritionist, respiratory therapist, as well as a equipment device for respiratory equipment type of representative. There are others, social worker, ALS nurse, ALS association nurse, the ALS physician, the ALS fellow, the research coordinator, the social worker. But having that rehab team there is very helpful to enrich your exposures about splints, modifications, exercises based on the levels of disabilities that's progressive in people with ALS. And of course, research is very important to us. There's a 2-month integrated rotation throughout the year with exposure to research. There are intense didactics as part of the fellowship. We have a neuromuscular lecture series throughout the year. We have intraoperative monitoring case studies once a month. In those lecture series, we yield that to an IOM case study. There's neuromuscular research checklist. That's a weekly meeting on Monday morning. There's muscle, skin, nerve biopsy conference, and that's on every Wednesday of the month at noontime, right after biopsies at 8 a.m. and 10 a.m. Then we have biopsy conference. Journal club once a month on that Wednesday. EMG case conference every Thursday morning. EBM, evidence-based medicine lecture series on Thursday mornings at 8:15 a.m. till 9 a.m. Case presentations, that's on Friday morning. These are neurology case presentations. Fellows are required to attend to keep in touch with their neurology skills. And Friday at 8 a.m. is neurology grand rounds, another required attendance. So we have a strong curriculum that really not only are you getting enrichment by a diversity and volume of cases in the clinic, but you're also getting the opportunity to learn from expert faculty. So some of you like being on call. If you like being on call, this is not the fellowship for you. I'm sorry to disappoint you. However, what you'll get in exchange for the, not being on call is exposure not only to the ALS Association Clinic, biopsies, EMG, and neuromuscular clinic, but we have both weekly adult MDA clinic and every other week pediatric MDA clinic. Some of our fellows have applied successfully to an internal funding mechanism through the VMR scholarship, whereby I've sent fellows to University College London to do a 1-month rotation there and learn about research going on at Queen Square. Of course, benefits are standard. You can see them listed here, but this is part of your employment benefit package. We're internationally recognized as faculty that are expert in the field. We're invited to speak at national, international meetings. The faculty are consultants on research studies, clinical trials. We have ample publication portfolio. I guess I should brag a little bit. At last count, my publication, and I've lost count a little bit, but I'm maybe 1 or 2 months behind. At last count, I have 200 publications in PubMed. We have excellent Google Scholar H Index, maybe you're familiar with that. But that tells you that we are interested in the academic pursuit, in publication, research. And there's a diversity of exposures you'll get from the patient standpoint, meaning you'll get exposed to anterior horn cell disease, SMA, ALS, peripheral nerve disease, cryptogenic neuropathy, diabetic neuropathy, CIDP, GBS, amyloid, transthyretin amyloid neuropathy. You'll see a diversity of nerve disorders, neuromuscular junction, muscle, myositis, muscular dystrophy. And here what you see is a picture from FSHD World Day, where we have our research team engaged in trying to get a nice picture. These are some of our research coordinators. In the window in the background, what you see is that building that I showed you where our research is conducted. And we have both adult and pediatric exposure. So our research, for example, we have research on Duchenne muscular dystrophy, on facioscapulohumeral muscular dystrophy, limb-girdle muscular dystrophy, myotonic dystrophy, Pompe disease. So you name it, we got it. So how do we make it happen? This is our team of physicians, and soon enough we'll be at 8 neuromuscular specialists. Swati Chandrasekhar graduated from fellowship with us July and joined us on faculty as neuromuscular faculty member, junior faculty member. Konstantin Formakidis also joined us. He was at Montefiore, left there about 3 years ago. It's been delightful to have him, very interested in myasthenia gravis, but also a superb educator. Omar Jaudat is in charge of the ALS Association Clinic. He directs it. He has an interest in ALS research, a superb educator. I don't need to introduce to you Jeff Statland. He's internationally known for his work on facioscapulohumeral muscular dystrophy. I think I said enough about myself. Dua Jabari is very much focused on IBM, and that's where his research is, as well as seeing clinic patients, doing muscle biopsies, doing EMGs. Dr. Pajnor is Associate Program Director for Neuromuscular Fellowship, and she's Professor of Neurology. She is the Director of the residency program, neurology residency program. And I joined like a year after she joined, and she's a superb educator. And then soon enough, we'll have Eric Ensler joining us in the ranks, and our team will keep growing over time because we are in so much demand. Patients come to us from surrounding states, from Colorado, Arkansas, they come from Nebraska, Oklahoma, Texas. So we have our reputation out there. I had a patient wanted to come to visit with me from London, United Kingdom, but they couldn't do it because of COVID. So why Kansas City? This is a nice view of Kansas City. You see it in that picture. It's a mid-sized city, 2.5 million population for the metro area. It's very affordable living, but also the average age is rather young. So if you're interested in having an older population, you should go to Florida or some other place. But Kansas City, you'll see younger population commensurate to your age. It's very accessible. If you love traffic, for example, Houston, you may miss traffic if you move to Kansas City, for example. That's the problem. And it's got all the entertainment of a large city, where you don't have to travel, museums and other things that you can dream of. So this is some of what our fellows have said. But before I go over that, I would like to share with you what our performance is on the other end of it. 100% board pass rate for our fellowship. Our alumni, 1 is in private practice, 4 are in academic at University of Cancer Medical Center, and 6 are at other academic institutions, University of Colorado in Denver, for example. 1 is in Saudi Arabia at the academic institution in Jeddah. 2 others are at Mayo Scottsdale, and there's a couple of others here that also went into academic medicine. And this is some of the testimonials from fellows. I think for you that's important to see, and you can read through them. I'm not going to read all of them, but maybe highlight this one here. At KU, I'm confident you will see bread and butter neuromuscular medicine along with the zebras. And that's the key thing. You're not only going to see the just boring neuropathy, but you'll see the exciting stuff. One of the patients I saw today was someone who had seen 3 different experts across different states and came to me for their final opinion about neuropathy. So you'll see interesting cases along with the garden variety cases. The staff is very approachable, very supportive, mentoring. That's very helpful, I think, for fellows to know that and applicants to know that. At this point in time, I would like to open it up for questions.
Perfect. And then it's up to residents there. If you want to just chime in with your questions, since we're a smaller group, you're certainly welcome to do that. Or if you're more comfortable using the chat, we certainly can take questions that way. One of the questions that Sherlyn Adkins has been asking the last couple of nights is, what drew you to neuromuscular medicine? Why neuromuscular medicine? Why not something else?
Well, I mean, for me, and then Eric will have his answer as to how I fell into neuromuscular medicine, how I fell in love with it. You know, it just was a rotation I had as a PGY3 in neurology, where I rotated with the neuromuscular group, with the EMG lab, and I just felt at home as far as this is what I like to do for the rest of my life. It felt like the right discipline. This is from a personal experience, but I think the question is a bit broader in the sense of why select this field of neuromuscular medicine over any other field, multiple sclerosis, for example, or Parkinson's disease? Well, it used to be that the range of disorders that are treatable within neuromuscular disease are very limited, the autoimmune neuromuscular disorders. But now we've made so many exciting advances in the field of genetic neuromuscular disorders, whether it's Duchenne or spinal muscular atrophy, that this is the most exciting field that one can get into at this point in time. There's so many therapeutics we can offer and so many more that are on the horizon that are being developed. It used to be a field where the pharma industry had very limited interest in developing research, but now it is to the stage where there's a strong interest across the board in these rare diseases to develop new therapies, effective therapies. So I'm very optimistic about not only the current status of neuromuscular medicine, it reaffirms the choice that I made in neuromuscular medicine as a career plan, but also I think the future is very bright and very encouraging based on the volume and the interest and the richness of the research and development that's going on in that field to create new therapies for our people with neuromuscular disease. Eric, you may have a different perspective on this.
I just think neuromuscular medicine is so interesting. I mean, I can just tell you, like, my personal goal is to work until I'm 80 because I really like what I'm doing. Why would I want to stop? And the diseases are interesting. The patients are great. You really get to know the patients in neuromuscular disease. Often you follow them for a while. The problems are super interesting. A lot of times you've got to use anatomy as a schematic. The physical exam is still important. And, you know, the patients are so motivated. It's such a moving target now, you know, neuromuscular medicine. So I finished my fellowship, I'm not quite 20 years ago in 2001, and it's kind of gone from the people who could remember the odd stuff and could diagnose it. And now there are just so many exciting new developments in therapy. I was on a Zoom call earlier today. I'm on the advisory board for the Hereditary Neuropathy Foundation, and we had a 2-hour Zoom call of their triad, the therapeutic research and accelerated discovery. And, you know, the patients are just so motivated and so great to work with. These people who just started the Hereditary Neuropathy Foundation, you know, on their own, and are just a force in getting funding and research. The AANEM is great to work with, very fun organization. Mazen has worked quite a bit with, and I'm now on the medical advisory board for the Myositis Foundation. or the Myositis Association, TMA, which is another just great association of really motivated and excited patients that just kind of help catalyze our work. And it's just really rewarding to work with them.
Thank you very much for sharing. We appreciate hearing what brought you to neuromuscular medicine.
Is there any opportunity for practicing neuromuscular ultrasound? That's a particular interest of mine, and I will be working with the fellows on that.
So currently, we have entrapment neuropathy ultrasound available with Dr. Jaudat. We have muscle ultrasound available with Dr. Statland. But with having Dr. Instrud join us, we're going to expand our range of ultrasound use and teaching to the fellows oncoming classes starting 2021 and into the future years. Thank you for this great question. That's a very important tool of medicine. This is an example of, like 10 years ago, you asked neuromuscular and ultrasound, they didn't kind of go together, but now we know that there's utility of neuromuscular ultrasound, and it's a great tool to have and implement at large academic centers like ours.
That's fantastic. Any other questions out there?
Thank you for your guys' talk. That was very helpful. I was wondering more about how the inpatient experience is run. I know Dr. Dimashki mentioned how there's the EMG portions inpatient, and then some other experiences. Do the fellows see like consults, or do they work with residents, and kind of how is that run?
So very good. So part of the exposure is that while you are on neuromuscular rotation 1, and we have neuromuscular 1, neuromuscular 2, neuromuscular 3, while you're rotating on neuromuscular rotation 1, you are also covering the neuromuscular consult service. What that means is there's a neuromuscular attending, that is staffing patients with you when we're consulted. We act as consultants. And when we're consulted at the hospital in the afternoon, after you finish EMGs, which is around 3:30, 4 o'clock, you will evaluate the patient. The attendant comes and staff the patient with you as a consultant. So for example, I know now I was talking with one of our fellows, Tim Fulham, and we have this year 2 fellows in neuromuscular medicine, for example. Some years we have 1, other years we have 2, but typically it's 1. They have a patient that's interesting at the hospital who has necrotizing myopathy, double antibody negative, and there's an issue of a uterine lesion, and they're trying to convince the team about the approach to that uterine lesion to make sure this is not a neoplasm. So we see a lot of interesting cases there. It enriches the exposure of the fellows by having that inpatient exposure. When it comes to EMG component of it, in neuromuscular 2, part of your assignment, instead of seeing neuromuscular consults, will be inpatient EMGs. So when EMGs occur in the inpatient setting on the afternoons of Monday through Friday, then you're invited to join the faculty in the performance of those inpatient EMGs. You'll see critical illness neuropathy, MG patients, you'll see myositis cases, Guillain-Barré, of course, and new CIDP cases.
Okay, that's great. Thank you.
Welcome.
Do you have any other questions?
I have a question about doing the biopsies. I know that doing the actual procedures is not something that's offered in most of the fellowships. I'm quite interested in doing those as well. How many of your fellows continue to do biopsies after the fellowship? Is it, do they get good enough to do it on their own if they go into private practice or academia?
Yes. So yeah, you get, I think that from where I see it, that our fellows have skills to be independent in performing the actual procedure, the muscle biopsies, the skin biopsies, The skin biopsy is relatively easy to learn. The muscle biopsy may require, about doing 10 or 20 biopsies before you get really comfortable doing them. And our fellows get plenty of exposure to those. So from the performance standpoint, and as I was alluding to it earlier, our fellows by mid-year are able to do those biopsies with limited supervision. My role going in there in the room is part of the billing requirements, so you have to be there at the critical portions of the procedure, which means during that 2-hour segment, whenever they cut the skin open, whenever they retrieve the specimen, at the closure of the skin, once it's done, I have to really authenticate that everything went well. So we are at that stage. Our fellows are now, they have still 6 months left, 5 months left, but they are already at that stage. So yes, you'll be able to do that. Now, whether you do it in private practice or not, it's really up to you. Doing biopsies is one thing. Interpreting them, that's something that we had to, more than 10 years ago, we had to have this, how shall I say, strong discussion with pathology about the fact that we are the most qualified people to read those biopsies. And now with me being UCNS certified, we're, doing that. So clearly, this is one area where there's a bit of tug of war between pathology and neuromuscular neurology about who reads those. And you have to be just aware of, depending on what institution you end up in or private practice you end up in, that you have that capability. I know there are few places in the US where a neurologist, a neuromuscular specialist reads biopsies. For example, Mayo is one of them. Johns Hopkins, they read their skin biopsies, for example. It used to be at Baylor. Dr. Horati used to have his lab there. So there are very few places around the nation that have this uniqueness.
Sandra, I'm just going to let them know I'm putting my personal email and my cell phone just as a message before we cut it off, because I'm going to be in transition. I'm moving here. So I'm sending that to you all. If you have any more questions that I can address, please don't hesitate to contact me. Text me or email me. Okay, I really, I've worked with 60 fellows over the 10 years I was in Boston. Really enjoy working with fellows, and I would love to have you come to KC and work with us.
Definitely, let me echo that. And I went ahead and put in my email address in case you have questions afterwards that are more specific. I'll be happy to talk to you about those.
All right. Well, thank you again, everybody. Have a wonderful evening.
Thanks for setting it up, Sandra, and dress warmly.
Yeah. See how much snow is on my car right now.
All right. Thanks, everyone.
Okay, thanks, Martha. Thanks, everybody. Yep.
Bye-bye.
Thank you.